All right. Good morning, everyone. 9:04. I'm already 4 minutes behind, but we're going to try to stay on time. My name is Susan Hwang. I am a neonatologist here at the Sanskrit's Medical Campus, one of the physician leads for Chosen Quick. It's really my pleasure to be here. I feel like this fall is just flying by, right? 1 minute it was end of August, and now we're like talking Thanksgiving and Christmas. But I love that we get to meet this way in person. I know some of us are online, but there are many of you in the room, and really learn and strategize ways that we can better support our families that are affected by substance use. So we have quite the day for you planned. I'll start off with a few overview slides, and then we'll transition into our workshops. We'll return here at 11:20, have a few keynote presentations. We'll have lunch and then continue on our way with our lived experience experts sharing their work. And you'll notice that throughout the day, we have 5 to 10 minute presentations given by different organizations throughout our state that serve our families affected by substance use. I think what we've heard repeatedly through these forums is that there is perhaps an inadequate awareness of the robust resources that may exist in our communities. So we wanted to highlight those today throughout the day. And you'll see that at the front, they are taking donations. So if you happen to have forgotten, as I did, the diapers, the baby stuff, there's a QR code to which you can donate. So please do that. All right. Okay, so we're going to do some introductions. Well, first of all, raise your hand if this is your first time at a Chosen Forum. Yeah, all right, that's fantastic. Raise your hand if you're from a hospital. Not a hospital. Raise your hand if you're from sort of a public health agency. And raise your hand if you're from a nonprofit, oh, nice. And then if you're not affiliated with any of the above. All right. Okay. This is getting more and more diverse every time we hold these sessions. When we first started, I would say 90% were from healthcare facilities, docs, nurses, etc. So I think the diversity present in these meetings is a really wonderful opportunity to go outside of our silos and strategize creative ways that we can wrap around our families in a much more multidisciplinary way. So I want you to turn around to someone that you do not know, say your name, and pick one of the three: your favorite recipe, your favorite book, or your favorite movie. I'm going to share all three. My name is Susan. I have a favorite recipe from the New York Times if anybody wants it. It's a white chicken chili. I do it in an Instapot, so it's real fast. If you want the recipe, let me know. My favorite book most recently is Demon Copperhead. If you haven't read it, please do. Very relevant to the work that we're going to talk about here today. Pachinko, written by a South Korean author, is my other favorite. My favorite movie is Top Gun. The original, it was, many of you are so young, but it first came out in 1986. If you ever want to like go through lines, I know the entire movie, like from start to finish. So I think that would be a really fun game. We could just go back and forth with lines. All right. So please do that now. I'm giving you 2 minutes. Yes. All right. So hopefully y'all have learned a new recipe, a new book, or a new movie that you're going to engage in. this coming weekend? Wow, y'all have a lot to say. All right, if y'all actually want to leave at 4 o'clock, let's wrap it up. And those of you on Zoom, feel free to chat in those items as well. Okay, so we're going to continue on. Oops. All right. So for those of you that have been attending these forums for several years, you know that we have had a transition in the last few years in terms of the focus areas of the collaborative. And I wanted to bring that to your attention, that while there was a transition, there is still active work happening in the original version of Chosen Quick. If you recall, we call this the 1.0 version that was really focused on birth hospitalizations. Much of it focused on Eat, Sleep, Console, optimizing non-farm therapy, standardizing farm therapy for those infants who required treatment. And then how do we think about sustainability in the long run? We transitioned to 2.0, recognizing that informed by our data, we had lots of deficits in our care. And so we're focusing on how do we better engage our outpatient providers, plans of safe care, implementation, and I would say even definition, and you're going to hear a lot about that today. How do we think about equitable toxicology testing, perinatal cannabis use guidance, and then broader naloxone distribution? What's not represented in the 2.0 is a whole host of other things that we're trying to do to better align our judicial system, healthcare systems, and child welfare systems. So there's some exciting work happening in that space in Arapahoe County. So truly our work has gone beyond the hospital because honestly, it had to. You know, healthcare and birth hospitalization, I always say, is really important. 99% of our births occur in a hospital. Many of our families who may not engage with the healthcare system will do so during birth. So it provides an ideal opportunity to engage with families. And yet we know that positive health outcomes come not from the hospital, but from the communities and from the walls outside, all the stuff that happens outside of the hospital. How do we wrap around supports and services outside of the hospital setting to optimize transitions?